Good afternoon, everyone. I'm Liz Fernandez with the VS Training and the National Training Exercise Program, and I'd also like to welcome you to today's webinar. We have two speakers today. Dr. John Baer is currently an Associate Coordinator for the National Animal Health Laboratory Network with primary focus on exercises and drills as well as other network duties. Prior to joining the NAHLN, John has served as a swine commodity health specialist focusing on swine enteric coronavirus, pseudorabies, swine brucellosis, and foreign animal disease surveillance. Also a training specialist with professional development staff developing and delivering program disease, foreign animal disease, and emergency response training. And he began his VS career as a field VMO in Missouri. Our second speaker is Dr. Robin Holland. Dr. Holland is the current head of Diagnostic Services Section at the Foreign Animal Disease Diagnostic Laboratory at Plum Island. She received her Bachelor of Science in Agriculture from Murray State University in Murray, Kentucky, and a DVM and PhD in the Veterinary Medical Scholars Program at the University of Illinois at Urbana-Champaign. Dr. Holland has trained at the Friedrich Laufer Institute in Germany, NVSL at Ames, and the U.S. Army Medical Research Institute of Infectious Diseases at Fort Detrick in Frederick, Maryland. She was formerly the lead researcher for COVID-19 diagnostic testing at the University of Illinois, establishing a high-throughput COVID-19 testing lab. Recently, Dr. Holland was deployed through FEMA to administer COVID-19 vaccines in Reno, Nevada. It is a career objective to advance global health through public service and to integrate veterinary medicine and scientific research to diagnose, treat, and prevent transboundary emergency and zoonotic infection diseases. And with that, I'm going to turn the webinar over to Dr. Baer.
Okay. Get started here. Okay, all right. Well, thanks everybody for joining today. We're going to go through a few things that are going to be important for the FAD-safe exercise coming up later on in the year. We're going to start with an overview of NAHLN and then go into some of the specifics related to that. Then I'm going to hand it off to Robin. She's going to go through some of the specifics on FADL. And then we're going to come back and talk about some of what it means for a NAHLN lab to be activated, and then wrap it up with an overview of our emergency validation and evaluation process for new samples and testing types. So as Liz said, go ahead, you can put questions in the chat box and we'll get to them at the end. Okay. Okay, so just a brief overview of NAHLN. The National Animal Health Laboratory Network, it's a nationally coordinated network and partnership. We have about 60 labs right now, and they are federal, state, and university-associated laboratories. And the three primary functions of the labs are to really increase our animal disease capabilities and capacities, specifically early detection, rapid response, and recovery, as well as doing surveillance for some domestic diseases and some other things as far as that goes. So, and the NAHLNs, and one thing to point out, hopefully we have a lot of foreign animal disease diagnosticians on the call today who will be participating in the exercise. And hopefully you all have your foreign animal disease investigation manual, and Liz is getting that updated. There's going to be a new section added specific to NAHLN. NAHLN is mentioned throughout the investigation manual, but there's really no specific section dedicated to it and for the types of sampling and things like that. So most of what I'm going to be covering are things that are going to be added to that investigation manual. Okay, so starting with the overall foreign animal disease investigation process. So for foreign animal disease investigations, they are initiated by the SAHO, by your state animal health official, your area veterinarian in charge, or their designates only. They are the only people that can start a foreign animal disease investigation. Anybody can report one, but they're the folks that have to decide to initiate it. And they assign a foreign animal disease investigation number. Once you start a foreign animal disease investigation, it's important to know that FADDs must submit sample to the reference lab, whether those samples need to go to NBSL Ames or NBSL FADL. They must go to one of those two locations. But a SAHO or an ABIC can go ahead and submit duplicate samples, not split samples, but a duplicate set to a NAHLN laboratory. It's not mandatory. They don't actually, they don't have to use that, but obviously it's highly encouraged. There's a lot of benefits, increased turnaround time, and I think most SAHOs and ABICs take advantage of their local NAHLN lab wherever they can. One thing that's really important to also keep in mind that if for some reason you don't have sufficient material to create duplicate samples by the collector, and that would be a really rare instance, I think, but if you, for some reason, you only have one amount of something or a very small amount of sample, the entire sample needs to go to the reference lab. You have to bypass the NAHLN lab and move on and just go ahead and submit directly to the reference lab. So then if one thing to keep in mind is that if foreign animal disease investigation samples are submitted to a NAHLN lab and they do not come in with an FAD investigation number, they cannot be tested. The NAHLN labs are instructed not to test any samples until they get that foreign animal disease investigation number, and that's a way to make sure that our state animal health officials and our ABICs are in the loop and know what's going on, and they approve the running of those samples. So here's two statements. So take a minute, read through these, and decide which of these is true and which of these is false. All NAHLN labs are approved to perform all available FAD tests. All NAHLN labs may perform FAD testing on any sample type. And this is two issues that came up for years when I was involved with foreign animal disease diagnostician training and continuing education, but just kind of think about that for a second. And the answer is both of those are false. They are definitely false. So what does that mean? So NAHLN labs are not all approved to perform all FAD tests. Some labs will focus specifically on avian. Some won't have any avian type samples or any avian type testing available, in a variety of breakdowns and a variety of combinations for there. And NAHLN labs are only able to perform FAD testing on approved sample types. Only certain types of samples are approved for use in the NAHL. And one of the things for when we've done foreign animal disease diagnostician training over the years, there's usually a slide somewhere in the training where we say, call the lab, call the lab, call the lab. And really with the NAHL, it's called the labs, plural. We have to call both labs to make sure that everything is that they're ready to receive those samples, that they're in the loop, and to verify that they're able to do the testing that we want to have them test for, and any procedures with it, that we collected the correct sample types that they're approved to test. So it's very important to call both labs. So we do have a couple resources available on the NAHLN website. This link will take you to the NAHLN laboratories that are listed by state and disease approval. So if you follow that link, you can go to the state that you cover or you're working in, and it'll take you to, and it'll show you what NAHLN labs are available and what diseases they are currently approved for testing for. But you still want to call the lab to make sure, because things can change, equipment can break. You always want to check and make sure. Now also we have this is something that was recently added to the NAHLN website. This is a link to a sample chart for regulatory submitters, and it lists the approved sample types for the various diseases that you would be submitting for to a NAHLN lab. And each of the labs receives an approved sample chart. And it's put together by the reference labs, and it outlines exactly what species, what sample types. And this is a version of that sample chart, which has a lot more information than what a submitter needs to know, and it's boiled down just for the submitting for the field end of things. So here's a little screenshot. This is actually the first part of the document that's available on our website, and it's a breakdown. This is foot and mouth disease, so you can get a look in here for exactly what is on that approval and what's approved in the NAHLN lab. And again, we have a reminder that not all laboratories are approved to perform each available test. You need to verify with that lab and be sure to contact them. So if you look at foot and mouth disease here, we go through cattle, sheep, goats, pigs, camelids, cervids, including cloven hoof zoo animals and wildlife. And the only sample type that is approved is vesicular tissue or swabs in TB media, oral or the lesions from the feeder or udder or wherever. So that's it. That's the only one that's approved in the NAHLN lab. So now there's more tests that can be run at the reference lab, so you're going to have a bigger bundle of samples, and we'll talk about that as well. The other thing to keep in mind is this is what is approved for the lab. However, let me back up a minute. However, this hasn't included wildlife here, and if we get in a situation where we need a sample of wildlife, we may, the labs would be approved to do that as submitted. Just keep in mind that there's also field policy in there too, and so there may be a policy where wild animals need to be submitted directly to the reference lab and things like that. So it always pays to check to call and double check. But but just keep in mind the labs are approved to go ahead and do those if it shows up on that list. Okay, so the NBSL reference, as I mentioned, the reference laboratory, they can utilize other samples than what's there on the NAHLN list. So submitting those unapproved samples to the NAHLN lab is not necessary. However, it probably does have some value to have a backup set of samples should there be an issue with that reference laboratory submission. You drop it off to FedEx, packages do get lost occasionally or delayed or, things like that. You still have another set of samples that if worst case scenario, we could send those samples on to the reference lab separately. So it's kind of a backup set of samples. And if you do a full set of samples and you pull a variety of things, one carrot we always, we've taught and you run into with owners sometimes, they want to know why their animal died or is sick or has whatever, and you can't really answer that. You can just say, well, we're going to rule out the foreign animal diseases. But you can say, well, I'm collecting these samples, I'm taking them to the NAHLN lab. If you want to have them tested for domestic diseases, you can do so. You just need to contact the lab, and that'll be at your expense, but the samples will be there if you want to go further with them. So that's kind of a little bit of a carrot. We're not going to pay for their domestic disease testing, but we have those samples available if they would like to use them. Okay. So for NAHLN FAD testing priority, so I'm not going to go into the decision tree for determining priority, but what does that mean when a priority, as far as when those come into the NAHLN lab, what is, how quickly are those samples going to be tested? How quickly are we going to have results based upon the priority? So priority ones that come in, those are the ones we have a high suspicion we have a foreign animal disease. The NAHLN lab's going to use, they're going to receive those samples possibly by extraordinary methods in addition to the ones that are going off to the reference lab. And those are going to be tested immediately upon arrival. It doesn't matter what time they get to the lab. Folks are going to get woken up in, whatever time that comes in. Priority ones need to be tested immediately. Same way with priority A's. Those are the ones we have a low suspicion, but commerce is involved, so we have to, do some, get those results as fast as we can so we can get commerce flowing again. So, and those also are tested immediately upon arrival. So priority twos, intermediate suspicion, commerce is not adversely effective. Going to still try to get those samples there as quickly as we can, and the NAHLN testing is conducted as necessary. If the sample arrives before close of business, test immediately. If it's after close of business, test the following day. So first thing in the morning, it will get tested. And Saturdays, so on the weekend, those are only going to be tested only with prior notification and approval. So everybody has to be in the loop and in agreement that they'll test those on those days. Priority 3s, those are our low suspicion, commerce isn't affected, routine methods for sample collection and transport, and we're going to have NAHLN testing conducted in a routine accession order. So much more laid back in getting those tested. Okay. So now, we do the NAHLN testing. Now we have results. How are those results going to be communicated? So reporting negative results prior to NVSL confirmation, the NAHLN FADI tests are all considered presumptive until NVSL confirmation is completed. Whether they're negative, whether they're non-negative, doesn't matter. They're all presumptive, and they all have to be cleared by NVSL. So, except for a few situations, but we'll talk about that later. So, FADI presumptive results, including negatives, should not be messaged in the LMS. So that's our messaging system, and for some disease outbreaks like VND, those are messaged. They go all the way into EMERS, and in the case of an outbreak, but that's our repository where we store all those results. And if they're presumptive, they don't go there. It's not yet. We don't want them in the system until we know for sure they're backed up by the reference lab, so they're not going to go in there. So negative presumptive results should be reported directly to the SAHO and the NVSL reference lab. That way the reference lab, they're still going to test those samples, but at least then they know that NAHLN lab had a negative result. And then our SAHOs and ABICs, they can make decisions as far as whether they want to hold animals, if they want to hold products, things like that, or releasing, quarantine, even potentially, but they may want to wait. But it's going to give them a better idea of what they want to do as far as actions with those animals. Or on those farms or premises. So priority 1 or A negative presumptive results should also be reported to the NVSL director. So as soon as those results come in, those are going to go to the director if those are negative, so that they know for sure right away. And because there's a lot of wheels turning when we have a priority 1 going on. So non-negative results prior to NVSL confirmation. So now, we've got a non-negative result in the NAHLN lab. We're starting to lean more and more towards the fact that we could have a foreign animal disease. So those results are immediately reported to the NVSL director, the SAHO, and the NVSL reference lab. So that could be phone call, email, a variety of things, probably phone call and email. But those non-negative samples need to, that's how those are going to be reported. They're not going to be messaged at first. It's too important a set of results to just slip into the data and walk away. So what we're going to do, so one thing to keep in mind is those non-negative samples in the lab, even though another set has been sent to the reference lab, they may, depending upon the situation, need to be submitted as a priority 1 to the NVSL reference lab. So imagine, you went out to a farm, you collected 2 duplicate sets of samples. You sent one off to the reference lab. Stopped by FedEx, dropped that off, went to the NAHLN lab. They set up their testing. That's in the process. Let's say you do that early in the morning. You get non-negative results in the NAHLN lab, and they're sitting there, and the reference lab's not going to get the next set of samples till the next morning. So there's probably going to be a pretty big drive to maybe take those samples that are non-negative in the lab and get them to the reference lab pretty fast. And that's going to depend on it, situation dependent. But just the labs and everybody needs to be aware that scenario could play out where we may want to get those samples to the reference lab faster than perhaps FedEx was. It's always possible you put in a priority 3 and you drop it off at FedEx and you come in and comes up non-negative. So that could happen someday. So just be aware of that. NPIC, the SAHO, and the ABIC will determine transport to the reference lab if that needs to be done, and extraordinary methods may be warranted, the whole white glove service and everything on those samples. So just be aware. And one thing everybody needs to be conscious of, you hear this a lot for exercises and in a lot of our trainings, but presumptive non-negative FAD results have the potential to cause major market disruption should not be disclosed to non-regulatory personnel until directed to do so. There's always a possibility we could have a false positive. You know, there could be an issue, there could be a problem in there somewhere, and you can do huge economic harm to our country until we get all our ducks in a row and get a plan together and everything. So really want to keep a close hold on all of this information. Okay. So 5 little tidbits of homework that all FADDs or responders or anybody needs to have in their mind, need to know this. You still need to call the lab. But everybody that's operating out there in the field, you need to know what NAHLN laboratories are available in the area you cover. You need to know what disease tests the NAHLN laboratories in your area are approved for. You need to know what your local SAHO and AVIC policy is regarding use of those NAHLN labs. Know how to contact an appropriate NAHLN laboratory in the event of an FADI, and know your NAHLN laboratory's policies for sample submission. So if you know those 5 things, you're going to be well on your way to being a very good FADD out there in your career. Okay. So I'm going to hand this over to Robin now, and he's going to tell you a little bit about the reference lab.
Sounds good. Well, thank you so much, John, and thank you, everyone, for joining today. So we are now going to discuss the sample submission process for FADL. So as outlined here, after you've completed your FAD investigation, you have your samples ready, you completed your 10-4 form, and you completed the entry into EMRS. You are now ready to submit your samples to FADL. The first thing is to make sure that you are indeed using FedEx Priority Overnight for FADIs going to FADL. If you send samples by UPS to FADL, we will absolutely still receive it, but we cannot coordinate courier support, so anticipate delays in receiving those samples to us. Also, please be sure to refer to your FAD prep manual for detailed instructions of how to complete the shipment information for both AIMS as well as FADL. So next, for FADL, please send an email to the email listed here, so fad.submissions@usda.gov. This is our notification for inbound cases, as this goes to our diagnostics team. It's also very important that you send this email the same day as the package was shipped. So please include in the email your FAD investigation referral number, the FedEx airbill tracking number, and the priority level. And also please attach a copy of your 10-4 with the FedEx airbill. And as John noted several times, also please be sure to call us if you have any questions whatsoever. For more routine priority 3 cases that you're doing more frequently, an email is sufficient, but we encourage you to give us these phone calls so you can make sure that we're aware of this case coming in, especially for these higher priority cases. Or if this is your first time submitting an FADI, please give us a call so we can run through everything with you. So often when we have these phone calls, we will discuss the expected timeline, especially if we have any delays that we are aware of that we've been encountering. And we'll also confirm that the samples you submitted were indeed correct and that the correct information is being emailed to us on our FAD submissions email address. For the types of samples to collect, the table on the right is also directly from the FAD prep manual for our primary agent of concern, foot and mouth disease. Although all of these samples are listed, not every single one is required for an FADI, and some of these samples can be used in place of one another. So for example, if say we were talking about ASF, you want to think blood. For CSF, you would think tonsil. For RHD, you would think liver. For SMV, I want you to think about lesions. So vesicular tissue, fluid, or swabs of the lesion for materials that are coming to FADL. We often get the question of, for these different lesion samples, which one is preferred? And here we have differences between what is great from the lab's perspective and what is practical in the field. So scientifically, vesicular fluid is a phenomenal sample, as this is where the virus particles would accumulate. This is especially helpful if we are working with an unidentified vesicular agent, as that particular sample is excellent for next-generation sequencing. However, we wholeheartedly understand that the vesicular fluid is the hardest to obtain either due to the vesicle itself being ruptured when you arrive, or there is not sufficient resources for restraint when you are attempting to aspirate a very small amount of fluid from a sensitive lesion on an animal that does not want to be restrained. So if you cannot collect vesicular fluid, that is perfectly fine. But this is also why swabs or vesicular tissue are so valuable as well, because they are right at that site where the virus is being produced. And in general, if you can send us serum, we are happy to perform serology for the major agents of concern. And also please consider which samples you would like to collect for all major agents on your differential list. So for example, if your primary concern is foot and mouth disease, but malignant nephrotic fever, BHC, or blue tongue are also on your list, be sure to send us DTA whole blood as well. Remember, as John said, to collect 2 sets of samples, one for FADL as well as one for the NAHN. If you have limited samples or were only able to collect 1 set, the samples go to the NBSL at FADL or at Ames if you're working with that reference lab. Please remember to prepare these 2 sets and do not split the samples. So for example, if you collect 2 tubes of 3 mL of TBT with a swab in it and send the full 3 mL to each location, do not collect 1 tube of 3 mL and send half to FADL and half to NAHN. You want that duplicate set. And as John described, the NAHN will perform the initial PCR testing on certain agents that that particular lab has received approval for. If NAHN detects them non-negative, they will relay that information to us immediately, and FADL will then be prepared for even more expedited testing. For shipping materials to us, this image is also from your FAD prep manual. Please be sure to provide thorough labeling with all of the various containers having the correct information regarding that specific sample and case. Also be sure to have the appropriate containment measures, keeping in mind that your box toss around here a bit when it's on a plane on its way to us. Pressure changes and weaker seals can easily result in material spills, so it is important to have appropriate levels of primary and secondary containment, as well as absorbent material to provide security in the event a spill were to occur. Note that your primary containment may be, say, the blood tubes, oral packs, or formalin jars themselves. These are your first line of protecting your samples. Please double check that those vessels are tightly secured and any additional means of securement such as tape or laboratory film are also applied. These containers then go into another form of containment such as a biohazardous material bag in the event the primary containment fails. And including absorbent material within the secondary containment helps to further collect material in the event there is a spill. And lastly, ice packs are perfectly sufficient for sending samples to us. We especially want to avoid use of dry ice for materials that cannot be frozen, such as materials for histopathology, as freezing will introduce artifacts that will interfere with our ability to interpret information. For shipments, here I'm highlighting some of the most commonly asked questions and issues that we have encountered. Number 1 is please be sure to use FedEx with shipments coming to FADL. If you accidentally send FADI materials to FADL by UPS, as I noted, it will still reach us, but it will be slower, and we cannot expedite transportation with our courier through UPS, but we can do so through FedEx. If you ship a priority 2 through UPS, I will be reaching out to you to let you know that we cannot complete the testing as quickly as we typically do for other priority 2 cases. Number 2 is using FedEx priority overnight. This option will ensure the most timely delivery of your samples to us. We have unfortunately encountered some delays with the other options, so please be sure to choose FedEx priority overnight. Number 3 is to choose the appropriate priority level in the recipient's name field. Some groups like to fill out the air bills in advance, and they will copy the information shown here on this example identically with FAD priority 1, 2, 3A. Priority level who are interested in shipping. So for example, if you fill out these air bills in advance, you can either circle your chosen priority level or cross out the others just so it is clear to us which priority level is being requested. Number 4 is to include both the Orient Point and Calverton addresses for FADL. You can think of Orient Point like our Plum Island mailbox, and Calverton is the FedEx location. So it is important to include both addresses so it is clear which FedEx location the package needs to go through and the final destination to Orient Point. And lastly is to choose the appropriate hold time for FADL submissions. If you are sending packages earlier in the week where the package should arrive before the weekend, choose hold weekday. This means that the package will be held at the Calverton address, which is where our courier will meet to pick up the package for expedited testing. If you are sending packages on a Friday or over the weekend where the package should arrive during the weekend, choose hold weekend. This means that the package will be held at the Calverton address, which is where we have a designated cold storage unit, so your package is not sitting in our warehouse over the weekend without additional cold storage before being picked up on Monday. And I will note you can complete these air bills electronically online. I have heard that there have been some challenges that people have encountered in entering both the Orient Point and the Calverton addresses. If this happens and you can only enter one, enter the Calverton address, as this facility is very well aware of our shipment needs and we communicate with them on a daily basis in coordinating shipments. For the 10-4 form, this example is also pulled from the FAD Prep Manual. In general, please be sure to fill out the entire 10-4 thoroughly and to the best of your knowledge. I do want to highlight a few areas where there are frequently asked questions. So number one is to ensure that your contact information is accurate and legible. If there are any issues or questions, I will absolutely be reaching out, so please make sure that your contact information is legible to help expedite this process. Number two is to include data on the number of animals involved, including those in the herd, affected, and dead. When we complete an FADI, we take into account the whole clinical picture. So having information on the number of animals involved is very helpful, and we may adjust our diagnostic plan. So for example, if a case such as this with 100 of 200 animals being affected tests negative for all major FADs, we may very likely reach out to you to discuss if you have any interest in pursuing additional diagnostics, given one of our roles as a foreign animal disease diagnostic lab is to be on the lookout for new and emerging diseases as well. Number three is to include the FAD investigation number. So this number is provided by your state, so the year, date, and current count. So for example, 21 New York 00552. If this number is not on the 10-4 or otherwise identified, as John noted, we will not perform the testing or send out the results. So I will be reaching out as soon as possible to get that number once our team realizes that it is missing. So number four is to clearly identify what is being sent. We cross-reference all of our materials identified on the 10-4 with what was received in the package. If there is a discrepancy, we will be reaching out to make sure that there was not an issue with the incorrect package being sent. Please make sure that not only do the identifiers match, but the actual count of samples match as well. And lastly is to provide a thorough case history. Please include any information that you find relevant to your investigation, such as when the issue started, how quickly it developed, and if there are any other contributing factors, such as travel or introduction of new animals onto the premise. This information allows us in the lab to see what you observed in the field. We have a variety of subject matter experts across FADL, and information you provide in the case history may be critical for us in developing a diagnostic plan. And as you are completing your FADI investigation and entering information into LIMS, I do also recommend that you attach the 10-4 into EMRS as well. For the notification for FADL, it is very important that you send us an email the same day as the package was sent. Please send this email to fad.submissions@usda.gov. Please note that this email is only for FADL, not teams. This email goes to our entire FADL diagnostics team, where our staff will either will then start to enter that information into our laboratory information management system to prepare for receipt and expedited testing of your samples. This email also goes to our courier, who will be alerted that your package is inbound, so he can make arrangements to pick up your package the next day. On this email, please include the FAD investigation referral number, your FedEx tracking number, and the priority level. Often, submitters will put that information into the email subject line as shown here, and that works great, but as long as that information is included somewhere in the email, that is what is important. Also, please attach a copy or picture of your 10-4 form and either your FedEx air bill or your FedEx receipt, just so we can see that number, your FedEx tracking number. You may also include information in the body of the email. So, for example, you can include additional information on the history, pictures of the lesions, and whether or not the case has been uploaded into EMRS yet. And you are more than welcome to include additional information that you find relevant. It is also very important that we receive this email the same day as the package was sent, so we can make our courier arrangements. If you send the email the morning of when the package is set to arrive, we cannot arrange courier support in time. And I will note that given our colleagues from coast to coast, we monitor this email account late into the night, so never worry about sending an email after hours. We will absolutely receive it. And as a reminder and follow-up from what John said on the priority levels, these occur from the lab's perspective on a spectrum from emergent to routine. So on the routine end, we have our priority 3 FADIs, the low suspicion of disease, commerce not being adversely affected, and these will go through our regular testing algorithm. For the next priority level, priority 2, these are an intermediate suspicion of disease, commerce is not adversely affected, and because of the higher suspicion, we will perform expedited testing. The next highest level are the priority A's, and these are practically the same as priority 2s clinically, but there are additional circumstances that adversely affect commerce, and thus we expedite testing. Then the highest level are the priority 1s, and these are in a completely different league as these have a very high suspicion of disease, and we do go to exploratory methods to complete that testing as well. And to give you an idea of our courier services that I've been mentioning and why it's so important that we receive advance notification, I wanted to explain this process as well. So when we receive notification of an inbound priority A or 2 submission, our courier is immediately notified and he starts making arrangements to pick up the package first thing the following morning. For our courier support, our courier starts in Connecticut, takes a 30-minute ferry to Plum Island, and then takes a second ferry to New York. He then drives to Orient Point Warehouse, where he picks up a truck that is outfitted to carry potentially hazardous materials. He drives about an hour to the FedEx facility. He then picks up the package, goes back to the Orient Point Warehouse, the marina, and then hand delivers the package to the Plum Island laboratory. So it's important to realize that in order for this to occur, there's a lot of steps involved in this process. So this is why very early notification by email is so important. If you do not give us the notification that your package is inbound, we cannot arrange courier support in time. I next wanted to go through the process of how, in ideal, priority 2 investigation occurs at FADL, and for this we'll use a cattle vesicular case as an example. So on the first day, you will be performing your FAD investigation, collecting samples, entering the information into EMRS, and sending the package to us by FedEx and alerting to us of the inbound package. Our courier will be notified at that time, and our lab will start making preparations to receive your package. On day 2, our couriers will arrange for early pickup of your package and go through the process we just described and deliver the package to the lab, and our team will get started with testing. For vesicular testing, we should have the initial PCR completed that day. For definitely FMD and hopefully vesicular stomatitis as well. Typically, we are able to start the FMD serology for overnight incubation following the next day. We also get started the virus isolation right away, and once we get in those initial results, we will send you a partial report. On day 3, we'll finish up some of the serology testing and send out another report. Then unfortunately, the test that takes the longest to complete is the virus isolation because we are quite literally waiting for our virus to replicate in culture. Some things grow relatively quick, but we need to allow sufficient time for if something is there, it has been given plenty of time to grow. After about a week, the virus isolation should be complete. If something grows, we do additional testing such as PCR, sequencing, or electron microscopy. And I just want to note that this is an ideal situation. Different things can shift our timeline. So it depends on where your priority 2 fell into the line of other priority 2s. If we have any other unexpected delays or things that could help us go faster, you might see this timeline shifted. And in general, priority 1, everything will shift to the left, go a little bit faster. Priority 3, everything will go to the right and go a little bit slower. And then I wanted to give some background on the assays that we perform and rough turnaround times. So here is a listing of some of the major types of platforms that we have. PCR is our fastest test. The primary question with this that we're trying to address is if the agent is there. So we're detecting the nucleic acid, and often those results are reported as detected or not detected. The PCR itself is super quick. It only takes a few hours, but there are additional things that make the turnaround time a little bit more slow, such as unpackaging, receiving, entering information into LIMS. We have our two different types of ELISAs. An antigen ELISA is detecting the antigen versus the antibody ELISA is a serology test. We also have a virus infection-associated antigen AGID test. This is also detecting if if there was a previous exposure to that. So it's a serology-based test. So the ELISAs and the AGID have a moderate turnaround time of a couple days. And then lastly, as we talked about, the virus isolation takes the longest because we're literally just waiting for that virus to go. And then I wanted to just illustrate the two types of reports that you can receive, a partial versus a final. It's notified on those reports which ones you're receiving. So the partial reports will clearly identify which tests are still pending, and it will be some time until you receive that final report later on where it has everything identified, and at the very end it will clarify that this is indeed a final report. And then lastly, to review the communication process. So this will depend on if you have a routine, priority 3, low suspicion case versus an emergent one. And basically the separation of these two is that if this is a routine case, you won't receive as much notification. If it's negative, you'll get your report. If we get an unexpected detection, communication will not be coming through me. It will be coming through veterinary services leadership, routed through the NVSL director. If it's an emergent case, there's lots of communication up front through the FADD, AVIC, SAHOs. They're keeping FADL in the loop. We're going back and forth throughout this entire process, so there's a lot more upfront communication as well. So with that, I will now turn this over back to John. So thank you so much.
All right. Thanks, Robin. Okay, so now what goes on, at least on the NAHLN end of things, once we have a non-negative, once we have a positive, at this point we have a confirmed positive, we have a foreign animal disease outbreak occurring, and so one of the very first things that's going to happen is once that confirmation happens, incident command is going to be established. And the NAHLN program office will obtain concurrence of the incident command and will activate a NAHLN lab in the state. So, so what happens during that activation? Well, there's going to be discussions with the NAHLN lab director, and those discussions are going to be what's your capacity, figuring out what funding is going to be needed, any other factors that may come into play as that lab, dramatically shifts its role to handle all the testing that's potentially going to be happening due to that incident in their state. So, and there's going to be discussions with incident command. How are we going to differentiate incident control zone testing versus FADI testing? So we have FADI numbers. We may have incident control numbers. We may have issued, instead of foreign animal disease investigation numbers, to try to keep those separate and try to figure those out separately because the lab may be having both, inside the control zone and outside the control zone. Then also figuring out what results communication and messaging policy is going to be. How are those, how are negatives going to be communicated? How are non-negatives going to be communicated? Working out all those processes, and then we could activate additional NAHLN labs based on need. Maybe they're not the closest NAHLN lab, but we think we're going to have an awful lot of testing, and there may be the potential to activate more labs. So that's the overall process of when those labs are activated and in the process of getting them ready. Once they're activated, they become inactivated 21 to 30 days after the last quarantine is lifted in the state. It just depends how long surveillance needs to go on afterwards. But once the last quarantine is there, the clock starts, you get 21, 30 days out, and then labs are deactivated and they go back to hopefully some form of normal life. So, all right. Okay, so during our outbreak, while this is happening, one process that folks need to be aware of is the emergency validation evaluation process. And this is a process that's been under development for quite a while, and it's really a way to evaluate sample types or testing modalities that we really can't do until we have the actual disease. And unfortunately, once that outbreak comes along, then we can really do some comparisons and do things that are really logistically difficult because they have to be done in containment or they have to be done in an endemic country overseas, which doesn't always work very well. And so there are some things that we can actually do. And so when the need arises, this plan can come into place. So you don't have to memorize the flow chart on the right, but if you boil that down to the parts that you need to understand, is that you can boil it down to six steps. So first, there's an emergency request, and that would come from the incident command, the SAHO, lab director, folks in communication. They were really coming mainly from the SAHO incident command. They would say, we really need to test, sample type X, or we want to use, a different piece of equipment, something along those lines. So that lab director, non-lab director, submits a deviation that we'd like to test. We start testing this disease, this sample type, let's say. And so that is reviewed by the reference lab in NAHLN program office. And very quickly, and this is happening in the space of hours, if not faster, we would assemble a methods technical working group, emergency approval incident management team. And that group is going to look at that request, and that's going to include the NAHLN lab, the reference lab, and the field. So the incident folks we're all going to come in together and put together a plan. And that plan is for what are we going to do to evaluate whatever we need to evaluate. And then we go ahead and we do that. And we collect samples, and we run those samples in the NAHLN lab and the reference lab, and we collect and compare the data that comes in. And then the Methods Technical Working Group Emergency Approval IMT looks at the data, and they make a recommendation. And it's not a given that would be approved, but it may prove to be a very good sample type, and then we would be potentially adding that as something that we could use during the outbreak. So those are the 6 points to boil that process down. And the takeaway points for responders that we want responders to really understand is that the SAHO Incident Command can or should make the request. The Methods Technical Working Group Emergency Approval IMT meeting will be scheduled as soon as possible, as soon as we can get everybody together for a phone call. And it's really treated as an emergency. Hey, we got to get going on this. Let's get everybody together. We need to do a plan. There's going to be a sample data collection plan put together that will need to be followed as close to the letter as we can. If we deviate from it, we may mess up the data. You can't do that. So put together a plan. It may need to be repeated if something is awry or we didn't quite collect enough data. It may need to be repeated, and approval is not guaranteed. It's really going to depend on the evaluation of that to see if it's going to be valid. And that's a good thing, because if it doesn't work, we don't want to start doing it. So during this process, the challenges that everyone needs to be aware of to that process is there's some unique challenges specifically for the laboratories. And so you have outbreak testing going on, plus you're going to be doing an emergency validation evaluation testing. So you need to kind of keep those separate. They may have two different results reporting structure, and there may be some overlap. Some samples that are collected for emergency validation may be in premises that we're doing surveillance on, and that needs to also be reported as part of the outbreak. So managing the data that it's generated through that process is going to be a real challenge, plus just the volume of testing. and having people dedicated to shepherd that through the process is going to be a challenge. The challenge for responders is this could be a very large number of samples that need to be collected in order to have enough data to validate or evaluate that sample type or that type of test. And we have to collect the approved samples and unapproved samples to compare the two together in the case of evaluating sample type. So we have approved and unapproved, and we have to have duplicates of those. One set has to go to the NAHLN lab, one set has to go to the reference lab. So you're really collecting 4 sets of samples, 2 of which go to the NAHLN lab, 2 go to the reference lab. That's a lot of work. And one of the challenges that we're going to run into in an outbreak is quick depopulation versus sampling. This process really doesn't want to jump in front of the depopulation train and say, oh, no, wait a minute, don't depopulate these animals. We need to do an emergency validation. And it's probably not going to happen. So we need to be ready. We need to be aware that this process is out there. It's going to depend a lot on the situation. If it's an avian disease where potentially we're going to be doing ventilation shutdown within, as fast as humanly possible, that's going to be very different than say, depopulating a huge dairy where those cows, for humane reasons, are going to continue to be milked, and we maybe have an opportunity to get in there and get some samples and things. And the opportunities are going to present themselves. There's always a way to get things done, but sometimes it's going to cause some unique challenges. So, all right. So that is that wraps up what Robin and I wanted to present.
Okay. Thanks, John and Robin. That was great.